Hello guys, I am Dr. Sonali Jagati and today we shall be discussing about a very important aspect of first trimester ultrasound screening, that is the nuchal translucency, abbreviated as NT. Now this is a very important ultrasound that we routinely advise to all our antenatal female. Now why is it so important, what are its implications and how do you do it? Let's try to understand. So this is a direct screenshot from the Williams 26 edition, in which they have told that nuchal translucency represents the maximum thickness of the subcutaneous translucent area between the skin and the soft tissues overlying the fetal spine at the back of the neck. The NT is measured in the sagittal plane between 11 and 14 weeks of gestation. So we also tell it as 11 to 13 plus 6 weeks. Okay. Using some precise criteria. This is given by the AIUM as well as the IUCOG. When the new NT is increased, the risk for fetal aneuploidy and other structural anomalies, in particular the heart defects, is significantly elevated. Now that's why treated as the first trimester aneuploidy screening tool. The cutoff we use is more than equal to 3 mm, and that is associated with increased risk for fetal structural genetic abnormality and is an indication for detailed fetal anatomical survey. Right? Let's look at the guidelines for doing a NT measurement. These points have been asked time and again in your NEET PG also in various formats, and they basically want to know that each and every point of this guideline has to be followed because it's a very precise criteria. So remember that the angle of insonation is perpendicular to the NT line, that they refer to the probe angle of insonation. And the fetus is measured in the mid-sagittal plane with nasal tip, palate and diencephalon visible. Margins of the NT edges should be visible. Majority of the image should be filled with fetal head, neck and upper thorax. Fetal neck should lie in the neutral position. It's a very frequently asked question and should not be flexed or hyperextended. Amnion line must be separate from the NT line. Calipers should be placed perpendicular to the fetal long axis on the inner border of the nuchal membranes with none of the horizontal crossbars protruding into the space. So you can see here, this is an image which shows the correct positioning of the calipers. So the horizontal crossbars of the caliper should be placed just inside, okay, of the membrane, okay. It should not be like this or in between. So these are all incorrect positioning methods. This is the correct positioning of the caliper, and this is very important to remember. Also remember that in terms of CRL measurement, the NT should be is valid when the CRL is between 38 to 45 mm, okay, and the lower limit varying according to the lab. This is an image which shows the NT as well as NB. NB stands for nasal bone, which is also an important marker for aneuploidy screening, which we shall be learning subsequently. So you can see that they are showing you the correct placement of the calipers. Also the nasal bone should be visible, and also this asterisk points towards the third and the fourth ventricle. Okay. Increased NT is not a fetal abnormality per se, but rather a marker that confers increased risk. This is important point to understand. And as I have told, it is important risk for aneuploidies and higher risk for cardiac abnormalities. So they say that in case you have seen NT scan showing more than 3 mm, then you can offer a fetal echocardiography along with other testing, of course, other detailed fetal anomaly testing. And also if it is more than 3.5 mm or more, then it has to be done. So this was in a nutshell about the nuchal translucency scan, and why is it so important? What are the important prerequisites that you need to follow while measuring it? This is a scan that requires a great amount of precision as well as patience to be done to get that perfect plane, and it requires great amount of skill to actually do it, and we all must try to slowly try to perform it, or at least see when our seniors are doing. And also, if you have any doubts, feel free to write in the comment section. Stay tuned for more such interesting videos.